Thanks for listening in on my video. I'm Steve Clark with Ohio Health Benefits. We've created this video to talk about some of the changes to the Anthem Advantage plans that's happening for 2026. So again, I'm Steve Clark. I'm the owner at Ohio Health Benefits. We've been in business since 2004, 22 years of helping people figure out Medicare. And there's some significant changes happening for next year. And so specifically, this video was created to talk about those changes with the Anthem HMO POS plan. So while this video is not a comprehensive list of all the changes for the plan for next year, it does highlight some of the more significant changes that are happening for 2026. You should have received, if you're on the Anthem plan, the annual notice of change, or the ANOC as we like to call it, that was mailed in the month of September, which provides a more comprehensive list of all of the changes that are happening to the plan. If you didn't receive your ANOC or you can't find it, certainly reach out to us and we can send you one and also have a discussion with you on what some of the other changes are concerning the plan. That's a little bit what the cover of the annual notice of change looks like. And again, those were mailed in the month of September or no later than October 1st, as required by Medicare. So I would also start by saying that in general, we are seeing pretty significant changes to Medicare Advantage plans in 2026. That statement is not specific to Anthem, but just overall in the industry. The reason for those changes is really goes back several years with the Inflation Reduction Act, where there were some enhancements to Medicare, like the elimination of the Part D donut hole, but also funding cuts in general to Medicare Advantage insurance companies. And so because of those funding changes or funding cuts, and the fact that there's a significant amount of cost pushed onto the insurance companies to help with the cost of prescriptions and eliminating the donut hole, the industry trend is that we're seeing these extra benefits being cut back for next year. If you have concerns about what you're seeing in this video, or if you have concerns in general about your plan, not sure, depending on when you're watching this video, but you do have an opportunity to make a plan change from January 1st to March 31st of each year. There's the December 7th deadline that has already passed us, but again, in January, February, and March, a person on a Medicare Advantage plan can make a one plan change. They call that OEP, or open enrollment period. The December 7th period, the October 1st to December 7th period is called AEP, or annual enrollment period. So OEP is what an additional chance for somebody to make a plan change. Again, that's January 1st through March 31st. So let's dig into some of the changes with the Anthem plan. Probably the most notable, and maybe the one that people are a little bit bothered by, is the elimination of the Silver Sneakers Fitness program. Anthem has made a strategic decision that they are not going to offer Silver Sneakers to their members in 2026 on the Anthem Advantage HMO plan and their other plans as well in Ohio. While that maybe is a major annoyance to many people, we are told by industry experts that less than 10% of people on Medicare Advantage plans that have Silver Sneakers actually use it. But if you're one of those 10%, if you're one of the 10% of people using the plan, certainly using the Silver Sneakers, certainly we should look at options for you for next year, for 2026. The second is the reduction in the over-the-counter allowance. That's the money they're putting on your debit card. In 2025, the amount they're putting on the card is $107 per quarter. For 2026, that is going down to $35 per quarter in most of the counties. Some of the counties, it's a little different than that, but most of the Northeast Ohio counties, it's $35. And there's no rollover. So you want to use your benefit every quarter. If you leave any benefits at the end of the quarter, it won't roll over, but you will get your new replenishment starting the beginning of the following quarter. The elimination of the personal emergency response system, or the people like to call that "I've fallen and I can't get up" button. If you have that now, if you're using that, Anthem's paying the cost of that. They won't be covering that for 2026. In general, because of the elimination of the donut hole, we are seeing that many plans have higher cost for name brand medications. And that's also true with Anthem. Anthem does have a $275 deductible next year for name brand medications. And after the deductible, you pay a co-insurance or a percentage of the cost. So if you're only using generic medications, tier 1 and tier 2 medications, you won't notice any additional or higher cost. But if you happen to be using higher cost name brand medications, you are going to see higher cost for those medications in 2026. However, because the donut hole's been eliminated, anybody on a Medicare plan will have a maximum out of pocket of $2,100 in prescription cost. And once you reach that, you will be covered 100% for the rest of the year. They changed the dental benefit a little bit. In the current year, 2025, comprehensive dental is covered 100% in network. For next year or for 2026, depending on when you're watching the video, the benefit is 75%. So you do have a $2,000 benefit there, but instead of having 100% coverage, you have 75% coverage. And then elimination of the essential extras, right? So let me click on the next screen that shows those essential extras. So Anthem was unique in offering these benefits. So people that are bothered that they lost this know that Anthem was the only company that had this, and they don't have it any longer going forward. The essential extras used to be a list of 9 items when they came out with it 5 or 6 years ago. It's been pared down throughout the years. These are the 5 items on the list: dental, vision, hearing allowance of $500, assistive devices, healthy foods, transportation, utilities. Remember, you could only select one from the list, so nobody was getting all 5 of these benefits. We saw that the most popular benefit selected was certainly the $500 dental, vision, and hearing allowance. Probably second was healthy foods, and third was utilities. But again, for 2026, those benefits are going to be eliminated. In general, however, after we talk about the negatives, the plan does still look very strong for 2026. Anthem, we have more people on this Anthem plan than any other plan available in Ohio, and that's still true today. It's very strong in the benefits. A maximum out of pocket of $5,000 is strong and is lower than the industry average. $2,000 in dental benefits within and out of network coverage. Anthem added the out of network coverage a few years ago. So if you're not taking advantage of your dental benefits because you didn't think your dentist was in the network, you certainly want to take advantage of those benefits in 2026. Even if your dentist is out of the network, because they offer benefits in and out of network. The ability to add additional dental benefits. If you want to increase your benefit beyond the $2,000, you can do that. You have to do that early in the year. Anthem does have a 0 primary care physician copay. Their extremely large network of doctors and hospitals within the state of Ohio, and in particular within Northeast Ohio. And then also the fact that they're not requiring referrals. There are some companies for 2026 that are requiring referrals to see a specialist, but Anthem is not requiring that. And then Anthem is still offering the over-the-counter benefit and the vision and the hearing benefits. So you do still have hearing aid benefits. You have an eyeglass hardware allowance. You get a routine eye exam, and you get the over-the-counter benefit of $35 per quarter that you can use at the pharmacy to pick up those over-the-counter items that you're used to getting. So we've got your back, right? I wanted to create this short video just to talk about the changes, but we want you to be happy with the plan that you're on. We will be holding Advantage meetings again to talk about more details on the benefits of the Advantage plans that we represent. So if you want to attend one of those, watch for announcements on that. We do those both in person and we do them virtually. If you're considering looking at a plan from another company, let's talk about that. While there isn't any plan that offers all of the things that Anthem no longer offers, there are plans that offer some of the things they're taking away. Silver Sneakers is a great example. Most of the other plans out there do still offer Silver Sneakers. So if you're really bothered by the Silver Sneakers or the loss of Silver Sneakers, talk to us. We want you to be happy. Let's do a review. Let's look at your plan options. Again, you've got that one chance to change from January 1st through March 31st. And if you make a change during that one of those 3 months, your new plan starts effect the first of the following month, effective date. Thanks for taking time to watch the video. Lots of ways to reach us. You can give us a call. You can email our service team. Our service team are all licensed agents. They can discuss in more detail the additional plan changes to the Anthem plan. They can start the process of gathering the data to look at plan options if you'd like to do that. And also you can text us as well. So if you've got questions, if you've got concerns, we want to know about it. We want you to be happy with your plan. And again, although we're talking about negative changes in general, that's what's happening in the industry. Medicare Advantages still are very, very strong. Medicare Advantage plans are still very, very strong. You know, we're seeing more than 70% of people that we meet with enrolling in Advantage plans. So it's just a little bit of a bump in the road we're faced with because of the funding cuts. But again, the plans still look very strong. So again, thanks for taking the time to watch the video, and we'd love to hear from you.